Welcome to the latest MedicoShorts podcast, brought to you by MedSynapse. MedicoShorts is a weekly program covering a wide range of clinical and scientific medical content that offers enriching insights into the world of general medicine. In today's podcast, we will discuss the details of a structured review, a study to optimize the medication safety of residents in long-term care facilities. This study was recently published in the March 2022 issue of BMC Geriatrics. Residents in long-term care facilities usually suffer from multiple chronic diseases that increase the use of multiple medications and therapies, which leads to an increased risk of drug-related problems. A drug-related problem can be defined as an adverse event that potentially intervenes in the health of the patient. Events such as adverse drug reactions, multiple hospitalizations, and mortality affect patients as well as the healthcare system. The involvement of pharmacists and physicians is an effective way to improve drug therapy. The drug-related problems can be targeted by providing medication reviews. The Pharmaceutical Care Network Europe defined the term medication review as a structured evaluation of a patient's medicines with the aim of optimizing medicine use and improving health outcomes. This entails detection of drug-related problems and recommending interventions. Different medication reviews such as comprehensive medication reviews, targeted medication reviews, one-time medication reviews are performed routinely in the long-term care setting to improve drug appropriateness and health outcome. Government-funded medication reviews is a practice which is already being performed in the long-term care facilities in many countries. There is a need for refinement of medication reviews in long-term care facilities, since general physicians and specialists are responsible for the diagnosis and prescription of medication in a few countries. Hence, this study was conducted to evaluate the effect of pharmacists-led medication review, also called an intervention group, that resolved the drug-related problems and patient-relevant outcomes compared to the control group. This study was performed in 3 long-term care facilities. There were 2 groups, an intervention group that received medication reviews and a control group that received usual care without medication review. The number of medication changes, also called primary endpoints, and discontinued medication, falls and death, also called secondary endpoints, in both the groups, before and after the intervention, were assessed. 107 residents and 104 residents from different facilities were included in the intervention group and control group, respectively. 76% changes were observed in the intervention group, as compared to the control group, on the first follow-up, with a significant p-value for both the groups, while comparable changes were identified in the second follow-up in both the groups. Overall, 1,252 drug-related problems were identified, out of which 61% were clarified. To conclude, it was observed that more medication changes were suggested in the intervention group compared to the control group, resulting in the discontinuation of unnecessary medication. This highlights the need for more routine medication reviews in long-term care facilities. This ends today's podcast, brought to you by MedSynapse. Thank you for listening.